Okay, so Dr. Dukhi, could you please tell me about her diagnosis?
The loss of motor control of the muscle is one of the leading factors in diagnosing ALS or motor neuron disease. And she has that classical, perfectly diagnosed and easy aspect to detect. But it's not just that. You have to look at her history, her age, factors, etc. When we look at everything, we are concluding that she has a motor neuron disease. Now, it must say also that worldwide, there's no known cure for ALS. None, absolutely none. We have already made attempts to procure the drugs for her. So in that process now, I've spoken directly to the administration of the institution, and we are in the process of procuring riluzole for her. How quickly? We'll try our very best to have that as soon as possible so she can start it. There are some other developing therapies such as stem cells, antibodies therapy, etc. But we are not going to go global with her in terms of giving her all. We are going to start as the drug that is most known to help patients with motor neuron disease. And then we are going to add to her treatment pattern and regime.
Have you had experience with this particular diagnosis before? I know you've studied a lot overseas, so have you helped out in any way?
Our immediate goal should be to prevent her from becoming bedridden. We are not sure, like you would, if you do some research on ALS, every individual who has ALS, and this probably is my third case diagnosed in Guyana, is that they have different manifestation. The timing is not the same. It depends on other factors, on the underlying conditions, age, etc. So she's pretty healthy, young. I think that we can slow the progression down fairly enough so she can enjoy quality life moving forward.
And does this include probably being able to, because we know her goal is to be able to basically get enough to look after her kids?
So I will choose not to get into the social aspect of that decision making, but what I will tell you, I don't foresee her being able to work anything using her legs, walking and go back to her job. I mean, she can find some sort of, I don't know exactly what she used to do, but she can of course use her hand perfectly well. She could draw, she could help with something, and there's a lot of patients. I have multiple patients with spinal cord injury who cannot move the lower limbs, and they're doing something for themselves.
I want to ask, it appears that Stacey has been coming to Georgetown for a while now. Is there, and this is obviously something that you would more so be able to deal with, is there a reason that it took so long for her to be able to get your help?
I think maybe it's just that to be channeled properly, but these things do, and especially in difficult conditions like these to diagnose. But you know, the end is we're happy to assist, and we're happy to be part of assisting Stacey, and I think we're in the right track.
Can you tell me, how do you feel after hearing about your diagnosis and the treatment that the ministry has supported Dr. Dukhi and his team to go about for you?
Feeling more confident. At least I'm getting to get the medication as soon as Dr. Dukhi say, and I'm feeling more confident and getting to get somewhere, because at one time I met Dr. Dukhi, said I'm not improving, but due to the medication I will, and